Hi there, in this video we are going to learn about radiotherapy and chemotherapy.
Radiotherapy is a process of using ionizing radiation to kill or control cancer cells. It also for cancer treatment, which is the radiated malignant cells normally disappear within a month, but it may continue in many years. Then we go to the differences of diagnosis to observe. Firstly, the radiation changes, which consists of two phases that are acute radiation changes and chronic radiation changes. Acute radiation changes, it is developed within 2 days after radiotherapy. Then it can continue for 6 to 8 weeks and disappear gradually subsequently. It can affect the malignant cells as well as cervical and vaginal epithelium. Chronic radiation changes, this can be developed 6 months or more after cessation of therapy, so it may persist more than 20 years. This chronic radiation changes is a reparative process. Post-radiation dysplasia. This cell can be developed after a latent period varying from several months to 20 years. Persistent carcinoma. These malignant cells seen during the course of treatment or shortly after cessation. It may exhibit nuclear and cytoplasmic radiation changes. Recurrent carcinoma. The malignant cells can be detected after a tumor-free interval of 6 months or more.
As the function of the radiotherapy can be used to disrupt the cell function and division. It will destroy the nucleus of DNA, inhibit cell synthesis, and also denaturing and coagulating cell protein and enzyme. For the curative radiotherapy, it used to cure or shrink at early stage of the cancer. For the palliative radiotherapy, it used to stop the cancer from requiring or treat symptoms caused by advanced cancer. Next is chemoradiation. Chemoradiation is used to help other treatment to be more effective as it can be combined with chemotherapy. There are two types of radiation therapy. The first one is external beam radiation therapy. External beam radiation therapy comes from a machine that aims radiation at your cancer. The machine is large and may be noisy. It does not touch you, but can move around you. It will sending the radiation to a part of your body from many directions. Next is internal radiation therapy. Internal radiation therapy is a treatment in which a source of radiation is put inside your body. The radiation source can be another solid or liquid.
Cytological features of acute radiation changes in nuclear, we can see degenerative changes, pallid chromatin, nuclear wrinkling or smudging, condensation of chromatin. Next, enlargement of nucleus, hypochromasia or normochromasia, multinucleation or binucleation, prominent single or multiple nuclei, cytoplasmic enlargement, and also abnormal mitosis. When in cytoplasm, we can see vacuolization in cells and or polychromatic staining, cannibalism of cells, perinuclear halos or vacuoles, hyalinization of cytoplasm with cell death, bizarre shapes with cytoplasmic tails, cytoplasmic enlargement, and also enlargement of nucleus. In the background changes, we also can see exudate in neutrophils. Cell debris resulted from local necrosis, presence of mononucleated or multinucleated histiocytes, and also giant cells. And sometimes we can see radiosensitive malignant cells with degenerative changes. In the chronic radiation changes involving basal and peribasal cells, we can see background of amorphous acellular pink material replacing the acute inflammatory background, nuclei hyperchromatic and chromatin homogeneous. Next, we can see cellular enlargement with nuclear hyperchromasia and cytoplasmic rills. Sometimes we also can see sheets of cells with multiple tails, less nuclear and cytoplasmic vacuolation. After 5 to 6 months completion of radiotherapy, If we can see there are no malignant cells, we can consider it as successful treatment. But if the malignant cells is present, that means there are persistent carcinoma or post-radiation dysplasia or recurrent carcinoma. This is called persistent radiation effect. The cytological features are more crowded, atypical, and hyperchromatic nuclei. The differences of cytological features in persistent radiation effect for post-dysplasia, we can see micronuclei may be present, chromatin finely dysplasia, crisp and well-preserved, multinucleation, cytoplasm has indistinct cell borders, irregular cell contours and shapes, eosinophilic but sometimes show biphasic staining. For persistent carcinoma, we can see hyperchromatic and pleomorphic nuclei and well-preserved chromatin. As for recurrent cancer, we can see background of RBC in conventional pap smear, prominent nucleoli, abnormal chromatin pattern, nuclei variation in size or in shapes, we call that as pleomorphism, sometimes showing molding, large dark nuclei.
Chemotherapy. Chemotherapy is a drug treatment that is cytotoxic to our body but effective in destroying cancer cells. It works by preventing the cancer cells from growing, multiplying, and proliferating more cancer cells. What are the functions of chemotherapy? Chemotherapy is a cancer treatment that involves the use of anti-cancer drugs to kill cancer cells. The drugs works by interfering with cancer cells' ability to expand and divide. Chemotherapy has been widely used to treat a variety of cancer. These medications can be used either independently or in combination, depend on what disorder is being treated. Chemotherapy not only works by killing the cancer cells all over the body, but it is also able to work on targeted specific sites. There are two types of chemotherapy, which are cytotoxic drugs and immunosuppressive drugs. First, cytotoxic drug. Cytotoxic drugs works by inhibit the cell division and cause cancer cells to die. It is also functions as palliative treatment of advanced inoperable tumor. Next, immunosuppressive drugs. Immunosuppressive drugs work by suppress or reduce the strength of the body's immune system. It is used to make the body less likely to resist a transplant organ. However, the risk of HPV infection is high.
Even though 47% of patients who undergo chemotherapy will survive from cancer by destroying actively divided healthy cells, but they still leave a permanent or temporary side effect such as fatigue, post-chemotherapy pain headaches, mouth and throat sore or known as mucositis, hair loss, nausea and vomiting, constipation and loss of appetite. Then why doctors recommend chemotherapy? It is because chemotherapy treatment will shrink the tumor cells before radiotherapy or surgery. Next, it will eliminate a relapse of cancer by eliminating any residual cancer cell. Chemotherapy also will reduce disease progression and symptoms in later stages, even if a cure is impossible to a patient.
Differences between radiotherapy and chemotherapy. Chemotherapy and radiotherapy are common modalities for cancer treatment. Radiotherapy is a process of using ionizing radiation to treat cancer. It can destroy or damage cancer cells, which is the irradiated malignant cells normally disappear within a month. So the changes in cellular may disappear in the end, may continue in many years. The chemotherapy is a process of using drugs to treat cancer. It can cause systemic effect and affect multiple tissues. Therefore, the changes seen in cervical, vaginal, urinary, and bronchopulmonary epithelium. So, this treatment can be done by itself or with radiotherapy.